is to give you a brief introduction to the One Health approach to zoonotic outbreaks. Before we go into details with the perspectives from human and animal health, I first want to make sure that you are familiar with the basic concepts of One Health. Zoonoses are communicable diseases originating from the animal population that can affect human beings. We speak of zoonotic outbreaks when such diseases spread with increasing numbers among the human population. When you look at a deadly disease such as rabies or rapidly spreading airborne infections such as SARS or bird flu, you will see the huge impact on human disease burden and economy of such zoonotic outbreaks. And because the interaction between human and animal populations is getting increasingly more intense due to our travel, the way we manage animals for food, and the increasing rate with which we destroy natural habitats, we must expect to see more and more significant zoonotic outbreaks soon. If we want to reduce the risk and impact of zoonotic outbreaks, we'd better understand how zoonotic diseases are amplified and transmitted. Among animal populations in the wild, among domesticated animals, and between those two animal populations. It is also important to consider transmission between animal and human populations through direct contact or vectors such as mosquitoes, flies and ticks. Lastly, some zoonoses like SARS and bird flu can transmit between humans directly. And with all those possibilities of transmission, zoonotic outbreaks can spread rapidly. The COVID-19 pandemic has painfully reminded us that an outbreak can rapidly spread across the globe, not only affecting individuals and societies, but the world as a whole. So you see that to understand zoonotic outbreaks, we need to look not only at the human sector, but at the animal and the environmental sector as well. And the interventions to stop or even prevent zoonotic outbreaks should also be coordinated between those different sectors. That is what the One Health approach is all about. First, One Health is a vast and at the same time straightforward concept. It covers human health as well as animal health and environmental health. One Health is a holistic perspective, where health links the human, animals and environmental sectors of our society. How does that work, you may wonder? Well, let's look at one example to illustrate this. Imagine the three sectors as intersecting circles, like in this Venn diagram. Do you see how these sectors overlap? Now, let's imagine the introduction of a new influenza A virus, for example, H5N1, carried to our country by a flock of migratory birds. They may contaminate the environment around some farms with their droppings. Or they may directly have contact with our domestic wildlife or farm animals. Our farm animals may become infected, causing large outbreaks among the poultry. This may infect the farmers, their personnel, and their families at first. And they may then transmit this new virus to their neighbours, friends, and other people in society. The infected wildlife and farm animals may contaminate the environment, for example, at slaughterhouses or live animal markets. Contaminated surfaces, water or carcasses may in turn further transmit the new virus to other animals or humans directly. This is just one of the examples of how health links the three sectors. I hope that at the end of this call, you will have a basic overview of the concept of One Health, which we can build in our next two calls to explore further how the human health and animal health sectors use this concept to coordinate their actions. Because coordination is needed between all sectors to make sure that all efforts are effective and well-timed. So with this example in mind, let's have a closer look at how zoonotic outbreaks may develop over time. You probably have heard already that One Health recognizes 4 distinct phases in preparedness and response to zoonotic outbreaks. These are preparedness, alert, response, and recovery. Let's take a closer look at these, shall we? During the preparedness phase, there is not yet any signal of a problem. Still, the identified risk factors are increasing, and the likelihood of an outbreak appears high. This phase must be used to prepare and get all processes and resources ready for the next phases. What do you think is involved in this phase? Well, think of everyone needed to monitor and assess alert signals of possible outbreaks, everyone that is needed to respond to outbreaks when they're detected, and everyone needed to contribute to the recovery after an outbreak. So the preparedness phase is about bringing people together and agreeing with them on working together in each of the following phases. The second phase is the alert phase, when suggestive clinical cases are reported in animals or humans. Here, everyone should be in place to do what is needed to pick up signals of possible outbreaks or emerging diseases. This means that many data need to be collected and analysed regularly and continuously. In other words, surveillance of communicable diseases. During the alert phase, we look for signals of spillover of infections from one population to another. This could be due to changing migration patterns, changes in vector populations, or changes in human behaviour, including activities that change the ecosystem. Such a spillover event could first occur between the wild and the domestic animal population. When this is followed by sufficient transmission within the group, in other words, amplification, then the spillover to the next population may be a matter of time. Once it is confirmed that more zoonotic infections than expected occur in the animal or the human population, then this is the confirmation of an outbreak. As soon as possible, we now need to move to the third phase, outbreak response. Here, our aim is to interrupt transmission and to crush the epidemic curve so that the situation returns to normal. We will look into much more detail of this phase in our next calls, dear colleague. The fourth and last phase starts after the outbreak is over. Here, we need to work on the recovery of the affected populations. This also includes learning the lessons from the evaluation of the previous phases. So this is what I wanted to say about the 4 phases in a nutshell. I will give you some more details from the human and animal health perspectives in our next calls. Right now, I want you to start thinking about the stakeholders that should be involved in this phase. During our next call, I will give you some more information on that topic. Now, so far, we've talked about One Health. But what is this exactly? Shall I tell you a secret? When it comes to details, then it depends a bit on whom you ask. For example, when we ask the WHO, they will say that One Health is an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve better public health outcomes. And when we then ask the World Organization for Animal Health, they will tell us One Health is a collaborative global approach to understanding risks for human and animal health, including both domestic animals and wildlife, and ecosystem health as a whole. And other stakeholders have slightly different definitions. If you want to know more about that, just have a look at the quiz in this module. Now, why should we take a One Health approach? Well, first, it ensures inclusive engagement, participation, and contribution of all sectors. How? By providing equitable platforms where multi-sectoral representatives co-own the process and the outcomes of a joint responsibility. Secondly, it has benefits from an economic point of view. You can imagine that working together is far more efficient than working in silos. In practice, we have seen a 35% cost savings with the Rift Valley Fever One Health interventions in South Africa, for example, or a 26% cost savings from integrated human-animal laboratory diagnostics in Winnipeg, Canada. Economists estimate that One Health approaches at the country level can yield a $30 billion annual return of investment for disease prevention and control. In addition, the One Health approach can be seen as an equitable platform for community participation. This is a benefit if we want to identify the most appropriate intervention. It also allows us to include social and cultural norms and beliefs in the interventions. This is especially important if these interventions depend on people changing their behavior. Community engagement will facilitate risk communication and helps us to identify gaps in knowledge. It also helps us to identify rumors and misinformation that may circulate in the community. Last but not least, community influencers may help you to reach affected populations. This requires building relationships of trust.